thinking out loud. Maybe we found love right where we are. When my hair's all but gone and my memory fades, and the crowds don't remember my name.
Ladies and gentlemen, welcome to Denver, Colorado for the 14th Annual HOPA Conference. Please make your way to your seats and silence your cell phones. The meeting is about to begin.
All right. Good morning, everyone. I'm Kate Jeffers, and it's my pleasure today to introduce our speaker for the morning, who was my division director when I was in residency. So this is a special introduction for me. So we're going to go ahead and get started. It's my pleasure to welcome you to Improving Writing and Speaking Skills. A few housekeeping items. You can find complete speaker bios located on the HOPA Conference app, and we ask that you hold all of your questions until the end. So it is my pleasure to introduce Dr. Rowena Schwartz. She is an associate professor of pharmacy practice at University of Cincinnati College of Pharmacy. Well.
Thanks, Kate. Thanks, HOPA, for this. I will say before I even get started that I was really just trying to decide if I was going to actually do this as a lecture or maybe invite you all out for coffee and have the conversation. So I think I'm going with the conversation, though you're not getting coffee from me. Let me start off. I wanted to tell you a story. When I was growing up, I'm the youngest of 5 girls, and we grew up in this, let's just say like we went to church at a place that was very fundamentally wanted the people that were part of the congregation to speak. So there was all these opportunities to speak. And so even as a young child, there was an opportunity, and I loved it. I loved it and I hated it because I loved volunteering. I loved taking an idea and developing it into a presentation. And I hated giving the presentation. I loved having the ideas. I loved getting up in front of a group but I really would get panicked and I would cry every time. Like, it's some of the worst memories of my childhood is sobbing in front of a large group of people when I was supposed to give a presentation. I tell that story for about 4 reasons. First, I really plan not to cry at all during this presentation. And I think that's a true testament that with practice and with looking at new ways to improve your speaking and writing, you can improve. If I do cry, that lesson is that even when you improve, you can always fall back to some of your natural tendencies. So that's a couple things. The other thing is, the real reason I told this story is I feel the most important thing about speaking, whether it be presenting or teaching or a small group, is the first 5 minutes. People get up and talk not knowing where they're starting, but knowing what you're going to say in that first 2 to 3 minutes. It will set you on the path that you're going to go through, but it also engages the audience. And it's been shown in research that audiences really engage best, even with complex scientific concepts, through stories. Now, I will tell you I've embraced that. In fact, I think I've embraced it more than I should, which probably brings you the last thing I probably should say for this slide, and that is the fact that just because they asked me to give this discussion doesn't mean I'm the expert. So as you go through, feel free to write down all the things that you think I should improve on, and then do that for yourself. So one of the things that I really wanted to do as we talked was to have a discussion. And with this room, when I saw it, I thought that's going to be a little hard. Now, we might still try to do that if I decide to get brave enough to walk down. So what I thought you would do is something that I see many of us do in meetings now, and that is look down at your phone. So I want you to look down at your phone, pick somebody who's not here or is here, or turn to the person next to you, but I don't like to talk to the person next to me if I don't know them. But if you turn and think, if you look at this meeting, if you had to pick one aspect of one presentation that you liked best, because I'm not going to go the negative route here, we're going the positive. One thing somebody did that you liked, that you think that you could use, text it now. I don't see you texting. And the funny thing is, I think within 20 minutes there's going to be a lot of texting. So there's a joke. we'll talk about humor and the inappropriate use of humor a little bit later. So, this idea came to me on Monday. I was driving I live in Cincinnati. I had a meeting in Pittsburgh, and my husband is from Pittsburgh. So we decided, because there's no direct flight, that we would drive the 5 hours from Cincinnati to Pittsburgh after I was done with clinic. So we got in the car, and after like 2 minutes, I was bored. So I decided to just ask my husband questions. So I thought this would be a really good thing. He didn't like it, but I thought maybe you guys would enjoy this. That's where this idea came from. Okay, faculty disclosures. I have nothing to disclose. I'm not going to talk about unapproved uses of any medications, but my true disclosures is, as I've already shown you, I'm going to talk about my husband often. He is the best butt of any joke that I can tell. I will probably talk about people that we all know from HOPA that have taught me, inspired me, or given me bad evaluations. We'll do that at the end. And that one of the things I'm going to talk about is the experiences I have, because as you can see, one of the take-home points is one of the key things about presentation is not the information you're giving. People don't come usually to hear data. They come to hear data in your interpretation of data. They come to hear what you, as someone who has looked at the topic in depth, is going to tell them that's going to help them. So one of the things I think is really challenging is to fall behind that whole, I have to present what's black and white in a journal, and not talk about the nuances that is unique to what your experiences are. And so I really ask you to share your experiences when you present, because that really is what helps people learn things and do better in their practices. So this is the key point. If you don't remember anything else, this is what you should remember. And this is from Dr. Seuss. And you can read it yourself, but I'll read it. Today you are you, that is truer than true. There is no one alive that is youer than you. I do that because one of the things I think is so challenging about presentation in the pharmacy world, in the oncology pharmacy world, is this concept that there is a way to do a good presentation. Every person has their own individual strengths that when they bring it to their presentation, when they bring it to their writing, it is the gift that you're giving in your presentation. So I say, don't look at what you were taught in any school or training as this is the way to do presentations. Use it as a backbone, but go beyond that. So if you think of who you really enjoyed listening to in the last couple of days, everybody, of course. But if you look, I think of that person that did the keynote presentation. He didn't do it in the pathway that you would normally present. He told a story, he used unique aspects that he had come across, and I think all of us, whether you were texting on your phone or not, walked away from that knowing more. So really, the key thing with presentation is what you're taught if you did a residency is great, but lose it when you're done, and think about what you really want to talk about. So these are my objectives for the session. I will talk about how to write good objectives in the later. This is not an example of that. So one of the things that I find with objectives is that they can be used for many different reasons, and we'll talk about this. I think reading you the objectives is probably one of the worst things to do to start a presentation. Oh wait, let me just say this. Any of you that presented at this meeting that did it that way, I'm sure it was really good. And I'm sure it was individually very, very good. So I'm giving you very much my perspective. And so my perspective is, that's what it is, my perspective. But when you look at objectives, when you sit down and you want to introduce with what you're going to talk about, tell people what you're going to talk about. Don't read your objectives. They're usually printed in a handout. They're usually printed in the information. So the goal of my presentation today, I really want it to be an exchange of ideas, meaning that I want you to give us your ideas. I want the group to learn from the expertise that's in this room of not only presenting, but those of us who have sat through lectures, we have good ideas that will help everybody in this room present better. I'm going to talk a little bit about how to write good questions. I'm going to talk a little bit about how to do some interactive learning techniques, and I really want to talk about some things that we can use for both presenting as well as writing. So here's a case scenario. A colleague contacts you and requests that you give a 50-minute presentation on the topic of chemo-induced nausea and vomiting. You're an expert on the area, so you say, I'll do it. This is not an audience response question. This is not there's a right or a wrong. One of the reasons I don't use a lot of audience response curves because I rarely think there is a one right and one wrong in life. So when preparing your slides, this is only about your slides, which of the following do you personally consider the most important? So you can see slide background, design and color, readability of your audio visuals to enhance your presentation, comprehensive content of the slide, or the answer depends on the intended audience. So I want you to think about that. And then I want you to think about when they ask you to do a presentation, what do you spend the majority of your time doing? And do those answers coincide? And I would suspect that most people spend the majority of their time doing their audio visuals and not on some of the other things. But again, personal question. Next question, same thing. They ask you to talk on CINV, and when preparing the topics for discussion, what do you consider the most essential? The objectives of the presentation, and you all have learned that I think of objectives as a real nice suggestion, but not necessarily a guide. If you laugh, I keep going, and it really takes my nerve level down. And if you don't laugh, I'll probably end up crying, and then my whole introduction will be garbage. So thank you very much. I'm gonna look over there. Audio visuals for your presentation, handout materials as reference, or knowledge base of your audience. So here's the second thing. We have gotten so used to teaching when we present and wanting to give the information to the audience that they can take back that we have learned to develop our slides so that people can take them at home and understand them. I think it has happened because how you teach in colleges of pharmacy, I put everything I can so that people can understand what I'm trying to say, because although I think I'm fascinating, perhaps that's not shared by the entire class. So one of the things when you're thinking about what you're talking about, what's most essential of what you spend your time with? And that takes me to the second most important point that I think I'm going to talk about. First, I think it's that you're individual and you use your own talents to optimize your speaking and writing. The second is that you look at what the true purpose of your presentation is. I'm not talking your goals, I'm not talking your objectives. I mean your true purpose of when you walk out of that room, what you want to have accomplished. It could be that you want to get through that 50 minutes without embarrassing yourself by looking like an idiot. That could be, and I have certainly had that goal and purpose in many presentations. It really is harmful to me because when that's going through my mind, I talk at a speed beyond that of an airplane flying. But one of the things that you have to think about is what is your purpose? And the reason I really emphasize this, because that you should come back to it again and again. Every time you're doing preparation, as you're actually presenting, are you meeting the purpose that you really wanted to set out to? So when I looked at this presentation, I thought, what was my purpose? And my purpose is actually to help increase the discussions of how we can be better speakers or writers. My goal is not that I get up here and tell you what irritates me about presentations and reading things that are written. My goal is to really try to increase that conversation. So I'm going to believe that all of you that are on your phone, no names, that you are actually texting what your ideas are to your friends that are not here or are sitting not next to you about things that you can look at. When I look at developing my purpose, it's the first thing I do. And when I look at that purpose, I use that as the impetus for brainstorming what I want to accomplish. And this is the thing I think people don't do enough. They think of what they're going to talk about. They go directly to the literature. They find what's in the literature, what they want to take, and what they think that they should share. Where the reality of it is, you should spend your time thinking about what you want to talk about and what literature you'll bring in to talk about it. It may be that you have to go to the literature first to get your ideas. My favorite part of a presentation, when I was 6 years old, crying in Joliet, Illinois in front of a congregation, or now when I'm not at an age I'm going to talk about in front of this group, and I'm thinking of what I'm going to talk about, is the time I spend thinking about the ideas that I want to share. I love the brainstorming. I write them down, I change them, I will be in a presentation of somebody else who I do not think is very interesting, and I'll have another idea. I'll be in a presentation 2 days ago sitting and listening to somebody say something that changed what I was thinking totally about this presentation. That keynote speaker said, anybody can present data. It's really what you talk about with the data that's important. It's really easy to do a new drug update, is kind of what he was saying. I love new drug updates. I love doing the reading for them. I love putting them together. I love hiding behind the data. But the thing I like about doing them is what he said, is giving my ideas of what I think about the new drugs. So taking that time to figure out what you're excited about, because when you're talking about stuff that you don't care about, it is very apparent that it's not something that you care about. So finding those things is important. From there, developing an outline. And if you look at this outline, you can see how very fundamental it is. So I don't go into nitty-gritty. I think of big key points I want to cover, and then I decide how much time I'm going to spend. And I'm looking at people in the room that I've probably said this to in their careers, but looking at where you want to spend your time helps you, because when you sit down to start putting your presentation together, you spend all your time developing slides for the first 10 minutes. So your first 10 minutes are so detailed, so wonderful, but then you're like so bored with it by slide 60, you have not had the time in it. So if you step back, put it in chunks, and take each of those chunks separately to develop, it's actually really fun to put the presentation together. And the key thing is, this is not a set in stone. So my worst thing about presentations, wow, I could ask that as open questions. What's Mo Schwartz's worst things about presentation? So getting slides in a timely manner. And one of the reasons is because I believe that the higher deity that created PowerPoint did it so that we did not have to get slides in months ahead of time. I believe it was a gift from when we used to have to use cameras to take slides, and you'd have to do them 3 months ahead of time. It was like getting a visa for another country. I believe that when you use PowerPoint, you can that morning make a total change. Now, that's not always what program conference coordinators, I've run a number of conferences, and I don't like when people do it, but I love to do it because I think it's really important with the way things change and how you get ideas that you constantly move forward. The other thing I think that we could talk about is I really would have loved this room to be very small and a discussion. I actually talked about, using the microphone and walking down and talking, but I'm a little too nervous to do it, and there's a reason I stand behind a podium. Being short is really good when you're nervous sometimes. But the key thing is when you're looking at whether it's a presentation or whether it's a discussion. So let's talk about nitty-gritty. Looking at the two lists, you can probably shift what you think is a presentation and as a discussion. The first thing I want to talk about is the very first thing under presentation of research. It's the reason most pharmacists speak in a certain way, because we learn to speak by presenting research. It may be our research, it may be somebody else's. When you go to ASCO, you don't care about the guy's story about when he was a young child talking in front of a group crying. You care about what the results are that he's going to talk about in 15 minutes of a trial that's going to change how you practice in terms of treating a man with prostate cancer. So when you go to those presentations, when you have a 15-minute presentations, the stories, the talk, you have that engaged person for 15 minutes because they want to know those results. That's a great way to focus that sort of presentation. To take that kind of presentation and flip it into an area where you're trying to help people understand doesn't work as well, because the data is really important. So last year was my first year back in teaching. I started my career working at University of Pittsburgh, and I was an educator there. And then I did other things, and I came back to, I went to University of Cincinnati, and we'll talk about the comparisons if we have time later. But the key thing I found when I walked into the classroom is, it wasn't the same as the 10 years when I was gone from academia, where I was presenting at formal business meetings when I was in corporate America, and I was presenting at the director of pharmacy when I was a director of pharmacy at Hopkins. It was back teaching. And what I realized is that it was a different way of teaching. because they didn't really care about the data from the study that just came out 2 weeks ago. In fact, the evaluations that they read there's a committee at Cincinnati when you have a course, and I'm looking down because I'm embarrassed, and they take your evaluations from the end of your semester and they show highlights of them. But they didn't show highlights like, we think she's really funny. No, they show highlights like, her slides have way too much information and we do not want all that study information. I understand their point. They don't want all that study information because they don't have the basic concepts down to be able to put that study information in context. It taught me something, and it taught me that teaching and slide decks for teaching are not the same ones you use for presentation. The other things I have listed down, I really want to just at least mention, and that is the small group sessions. It's my favorite way to teach, and it's my favorite way to present because it's a way to share information. And one of the things I'm going to say to you as we go through, I find the information I get from the audience more important probably than what I go to, and I'll give you a couple examples as we go through. So take home point, don't ever lose your purpose in your presentation, figure it out beforehand, and as you go through, think of it. Okay, goal for the audience. This is one of the key things I look for. What does the audience want? I'm like so curious looking at this room to figure out why people came to this session. And so I want at least one person, and I have the patience to wait till someone speaks. One person to say what they would want to hear from the group from this. I can do it too. Thank you. So knowing what your goal is like, it helps me to like determine. So the best way I speak is when I know what the goal of the audience is. When the audience is diverse, it's really challenging. My goal for an audience is that each of you walk out of here with some idea that you hadn't thought of yourself. So I'm going to tell you a story, and this is like one of those egotistical stories that I hate when people tell. So here you go. So long time ago, it was a pre-HOPA ISAP meeting, and I was asked to give a talk on complementary and alternative medicines. It was like the most fun talk I ever gave because I used most of my slides were taken from Ladies' Home Journal and such. And so I put this talk together. It was really fun. And one of the people there, her name is Carol Chambers. She's an oncology pharmacist from Canada. She's a powerful oncology pharmacy woman. And every time I see her, and this has been decades ago, she says, I always remember when you said that when you are learning about alternative therapies, read when you're checking out when you go grocery shopping, because that's where patients are learning about things. Now, the reason I tell you that story is that was not my main message, but what it said to me is that it was a message someone heard. She's older than me. She was more experienced than me, and she is much more global at the time than I am. And what she learned from this was something I thought was something very minor. So when you look at your goals and your purpose with your audience, it's diverse. It may be different goals, but it's important to know them and to try to reach them. Okay, which of the following audiences have you had the opportunity to provide a formal presentation to in the last 5 years? So I'm going to do raise of hands. I was going to make you all stand up, but I'm really embarrassed thinking that you won't do it. So how many people have given a talk in the last 5 years to pharmacists that are not specialized in oncology pharmacy? Okay. How about oncology pharmacists? Which one do you like better? So raise your hand if you like oncology pharmacists better to talk to than oncology pharmacists. So non-oncology pharmacists. How many people like non-oncology pharmacists better to talk to? Because you feel like you have more to share, right? Okay. Nurses. See, that's my favorite right there. Okay, never mind. Oncology nurses. Okay. Physicians. Okay. Non-pharmacists, healthcare professionals in training. Okay. Patients and patient caregivers. The way that you address is very different. So the biggest challenge is when that group is together. So that means that your presentation has to meet the needs of the entire group, which means that you have to make things basic enough for people that don't have the comprehension and you may have to go very high for people that have a lot of comprehension that you still want to meet. The problem with those mixed audiences is we tend to go toward the people that have the highest knowledge because we want them not to be bored or not to miss something. And we miss those people that really need to learn fundamentals. So what I've watched over this meeting, people do a really good job of going from fundamental to complex, and that is an art that I think is really one of the best things that you can learn in teaching. I wanted to tell you a story about something that happened that I think changed my way of looking at this. I worked with a graduate student this year who our concept was that non-oncology pharmacists in the community take care of our patients. She's doing a master's program in community pharmacy, and she likes oncology. So we worked with Kroger, and we put together this program where we took some of the oncology specialists in the city, and we did this like half-day program on updates of practical stuff for oncology pharmacists. It was fun to do. We did a pre-survey post. She presented it at APHA. Really nice. We did the program. I walked out of that program. I learned more than I think anybody else in that room. I learned more about how we could work with that group than what they needed to learn from me. So I'm embarrassed to say, well, I did tell you how like somebody remembered what I said, so now I'll tell you like one of the bad things I do. Yeah, I'll even it out that way. While I'm good and while I'm bad. So the bad thing, I walked out of it and I realized that we had all thought about what we as oncology pharmacists thought those community pharmacists should learn. And we didn't think about what those community pharmacists know that I needed to learn. So we have actually changed the program based on that. So one of the things that I find really interesting about presenting is not looking just how you impact the audience, but looking at how the audience impacts you. Okay, audience engagement. I thought this was a great slide to use because it's the most boring slide I think I have in my deck. So if you look at factors that really are important for audience engagement, one of the key things that you can look at is their foundational knowledge, how interested they are. The thing I think that you have to look at that nobody talks about, what time of day it is, how long is the lecture, and how burned out are you? Like how burned out are you today from listening to topics about oncology pharmacy? Okay, on a scale of 0 to 10, who's above a 5? You guys are liars. Ooh, wait, never call your audience liars. There's another thing. That's a key take-home point. But you get really, so one of the things that you look at is if you're the last day of a conference, you may take a different approach than if you're the initial lecture and everybody is like all together, like focused on it. And then the other issue that I think most of us know from if you teach in classes is it mandatory or voluntary attendance? So at University of Cincinnati, for the first time I started to teach at a place where the students, everything was videotaped. It is my nightmare because they videotape every lecture and then students can listen to it. Now you're going to think that I don't like it because of the fact that the students aren't in the class. That's not it. Because if a student doesn't want to be in the class, I don't want them in the class. Like I'm seriously okay if somebody stays at home and looks at the lecture. What I don't like is that every faux pas that comes out of my mouth, probably an average of 5 a lecture, is taped. And I realize that when I'm saying something, that's a story they're going to be listening to again and again. So I like to have cut my stories back a lot, which is one of the ways I actually teach, because I don't want them listening at home saying to their friend, come look at this, because I think that's really embarrassing. Because if you're in a room, they're not going to do that. So never mind. Okay. The Goldfish Theory. One of the things I think that's important to talk about as well is how much people can pay attention. And so there's this theory that was propagated, I think in 2014, 2015, from a study done from Microsoft that was published in Time that talked about the fact that humans now have a shorter attention span than a goldfish. I did not look at the study in depth. I do not know the methods they used. I do not know how they would look at a goldfish and see their attention span, but supposedly they have an attention span of 9 seconds, and we have an attention span of, 8 seconds. I really don't know how that you would do that. But the key thing here is that because of, they were attributing it to, because it was a Microsoft study, to all the digital technologies that we use and that we can't pay attention. I think it's true not because of the fact that we have all these digital things that are short. I think it's true because we're really busy, and so if we're not using our time well, we're using our mind to do other time well. But the key thing is when you look at the presentations that you give that are 50 minutes, people are not going to pay attention. So one of the key things is to look at how do you re-engage periodically. And how you re-engage periodically, we have historically done by summaries or audience response to engage. But I think it's the biggest challenge. One of my favorite things that was done at HOPA this year and previous years is using number of people to talk so that my voice, which my husband says you should never listen to for more than 1 hour at a time. Like, it's really good. He really does say that. Like, he has an attention span of 3 seconds. He is like a mini goldfish, like a, what would that be called? That would be like a cracker goldfish. Oh my gosh, I can't believe I'm saying this. I'm having fun. So I'm going home tonight. Hope he picks me up. But the key thing is to look at how you can keep doing it. The other thing that I think that study doesn't talk about is the motivation that you have based on what you want to learn. If I start practice in head and neck cancer when I came to Cincinnati, hadn't practiced it ever focused, I'm going to go into a lecture on head and neck cancer and I'm going to listen with everything in my soul. So one of the things is how much it really means to the person, how much they're going to pay attention. I do a lot of new drugs updates for Oncology Nursing Society groups. They want to know. I have never seen a more engaged group of individuals at a 7 o'clock program after a glass of wine that they will listen to a new drug update for 20 drugs because they're taking care of a patient that they want to do good for. So one of the things is finding those things that will motivate. I don't know what will motivate you. I don't know what will make you feel more motivational about like this topic. So I have not met this need. Format. So I put this in because I think one of the things that is really challenging is how you connect different formats. I think the easiest is when you're sitting in a group. So the guy with the big eyes, the key thing you're doing is that you're looking at people. And people know when you're looking at them, and that's engaged. So that's an easy conversation. The big group at the bottom, I think, is the hardest. And I'm looking around, I'm not feeling it that much, even those lights are in my eyes. It's not bothering me. But if this was like filled with 1,000 people, I would totally blank out on you and not pay attention, and so that you don't engage as much. One of the ways that people have tried to increase engagement of the audience with the speaker is to say at the bottom, doing those very big screens and putting your face up there. Do you know what I'm talking about? So ONS does that. The first time I did ONS where they did that, like you could see the like broccoli in my teeth from like 2 days ago. It's not a pretty sight. You know, like I dye my hair now. And so like if it's like the last week, there's like this silver that you're not seeing, right? Because I'm far away. But if you put my picture really big up there, you're seeing. So I change my hair dyeing based on if they're going to have a screen. That's a vanity, yes, but it is a vanity that I like. It makes me more confident. So knowing what that like environment's going to be like, I walked into HOPA, I walked into this room knowing that this was going to be this session, and I thought this is going to be really hard to do. What I had really hoped was to have you all talk. So I fell back to what I do when you can't have everybody talk. I'll fill up that hour. I mean, there's no doubt I can fill up that hour. Ask my husband, I can fill up the hour, but it's not as like much what I wanted to do. So knowing what the environment is before you walk in, and that may be before you walk in the day before, or it may be just 20 minutes before, and thinking about how you have to adapt what you're going to talk about. Okay, let's talk about some audio visuals. This is stuff that you guys love talking about. So this is my favorite slide. My favorite slide. Audio visuals. I call it the Jeopardy phenomena. My husband and I have become like Jeopardy addicts. And so what we do every night, this is really creepy. So every night we sit in front of Jeopardy, which we tape. We each have a clicker in our hand, and we compete. It's really fun. He's really smart. He knows goofy stuff. But anyhow, so we do that. And so what I have noticed is in Jeopardy, the rule of the game is Alex reads the question in his annoying voice, and then after he's done, the contestants can buzz in. So my sister, who actually was not a contestant, but passed that she could have been, said one of the guys next to her didn't make it on Jeopardy because they kept hitting it before, so they didn't let them on. So the key thing is with Jeopardy is that you have to let them read the whole thing before you respond, right? That makes sense. So here's the problem. At my house, my husband does not go by the Jeopardy rules. My husband reads it and answers before I have an opportunity. I think it's kind of cheating. I think it's why he scores traditionally ahead of me. But it's the problem with people reading what's on your slide when you're trying to talk. So when you have those busy slides, when you have data slides, it's fine because you're interacting with that data. They're not looking at it, you're orienting them. But when you have those text slides that have all this information, people aren't listening to what you're saying. They're reading the slide. And so it's really important to engage by how your slides go with what you're saying. So this Jeopardy question, I think you guys all know the answer, right? It would be the Chicago Cubs. Best, yeah, okay, never mind. It was a great year. Well, it was a great year for baseball, but that's all we're going to go. Okay, another thing, audio visuals. The bullet phenomena versus the use of audio, visuals. So I put my favorite slide that I have used in every presentation I have given in probably the last 3 years. I use it in presentations about CINV because you know what? I think you can always talk about the T cell. The reason I use this is because this slide, this chart, the reason I love it is because when people see it, they don't understand it until you explain it and you get to interact with it. The other thing is this slide is so beautiful, I actually have thought about maybe getting wallpaper with it. I think it would be very nice. I used to have a favorite slide that was something else, and I've changed it to this slide. So and when it comes up, I actually get a little adrenaline because I get to talk about it. So that's audio visuals and how that helps you. And then you go to what I hate, but I use, and that's bullets. And the problem with bullets are just ideas if you do them what they're supposed to be. But when we use them to give handouts to other people, we write full sentences. So when you put bullets up, you go right back to that Jeopardy phenomena, and people are reading your bullets and not really understanding what you're saying. So if you use bullets, more power to you, but try to use them where they're complementing what you're saying and not overwhelming. And then we get to what I call the bullet rules, which I don't agree with, which is one of the reasons I'm really surprised they asked me to speak, because I don't agree with most of the standard ways people talk about how you speak. And if you look at the bullet rules to be made, you should only have a certain number of bullets, there should only be a certain number of lines, there are best fonts to use, and that the one I do say, and this is my last one that nobody else says, you should never underline anything in a slide. To those of you that do that, I'm sure it's really wonderful and you do it the right way. But if you underline and people copy, they tend to blur, and so that it makes it harder for people to read, and especially people that don't have really good eyesight. And it's an aging population in oncology pharmacy. So underlining sometimes can make it not as clear to read. So the key thing is to optimize your use of slides with visuals, minimize your use of slides with bullets, and someday I have a dream that I will do an entire presentation with no bullet. That's my dream. I don't have high aspirations. When you get to a certain age, you don't have to have those big goals. No bullet slides, that's mine. Okay. This is a slide that I use in presentations that I absolutely love. And if you look at it, it breaks all the rules of what I just said, talks about too much information. But I love it because I learned that you can use these boxes, and you all do it, and you're all thinking, why am I talking about this? But I do it because people really do need the full information when you're speaking. So when you're really talking about the data, but you want to teach it, you give the data, but you focus on the point you think is most important. And that's why you're asked usually to speak, is because you have an idea of what's the most important. So use of complex versus simplistic, this is just comparing the two. I think that if you're going to use a complex, you start with the simplistic and then you go to the complex. The other thing I wanted to talk about is the template challenge. I'm going to tell a story. This is nobody's fault. So if you'll notice, my template is a template from last year. And you may think that's just because I'm didn't read my emails. And you might be right, but that's not really the reason. The reason is because if you look at the template for this year, it has those beautiful lines at the bottom, but that takes like a fourth of the slide. So I'm not saying they're good or bad. I'm just saying for me, anything that's at the bottom takes my space. But the other thing that you'll see is that the thing that I have at all the bottom of all my slides usually, I always have usually, that was kind of funny, never mind. What I usually have at the bottom of my slides is the reference. And when I go to a presentation, I want the reference. So I probably have written down on 5 sheets of paper references when I've sat in a session that I'm gonna pull when I go home. And so that's what I really want. If I wanna go back, that's what I wanna look at. So looking at that, it's really easy to put a blank template on it. And people don't do it. You just take it off. You just choose the blank template, and it's so much easier to read. It's also so much easier for handouts, which is if you're doing the handouts, taking out the template is really important. The use of tables, I think, is really beneficial. You see them all throughout HOPA, so I really didn't want to spend a lot of time with it. Again, this is an area to pull information that is from a study to focus people on what you want. So if you look at what this is, I took this study because I use it a lot, but it really brings out the immune-related adverse effects separate from the other, and I like that because I think that we focus so much on immune-related adverse events, and people don't focus on the thing that I think is so important with immune checkpoint inhibitors, and that's fatigue. So I think fatigue is huge. I think the data shows it's huge, but it's not the thing that people talk about all the time. So if you want like some concept that I think about immune checkpoint inhibitors, it's the fact that we should be looking at fatigue. So again, I got to talk about probably 3 things that I was not asked to talk about, and I got to slip them right in. Okay. Cartoon, definition of a cartoon. This is not a cartoon, this is a cartoon character. I love using cartoons, so I want to just talk about a couple things. 1, there are appropriate cartoons and there are inappropriate cartoons. There are inappropriate cartoons. I once gave a presentation with a cartoon that I thought was really funny. It was political. It wasn't this year or last year. It was a different era. And when I used it, I really thought it was funny. And afterwards, the guy that coordinated said, you know, I don't think you know the place that you're at. That political cartoon is not consistent with most people in the audience. And I realized that, like, probably when you're looking at cartoons, you have to realize that everybody doesn't have your own sense of humor. It's still a really funny cartoon. I pull it out periodically to look at it, but I will never use a political cartoon again. Until tomorrow, maybe. But I mean, I really do not use political cartoons because of that. The other thing I wanted to do is I put the one of Mickey Mouse because last year I bet John Kuhn, I said, if you wear Mickey Mouse ears at HOPA, that was in Anaheim, I'll pay you $50. So John Kuhn wore Mickey Mouse ears, and I never have paid him. I was looking for him here, he wasn't here. Too bad I didn't pay him, checks in the mail. So anyhow, the thing that taught me, a couple things, John Kuhn was willing to do something to humanize himself to a group of people. Because most people think of John Kuhn like the John Kuhn lecture, like he's like an icon type person. I trained with him, he's an icon, but he's a human. So I think that one of the things is to have people realize you're human is really good. The second thing he did is he did it because he connected with people in the audience by talking about why he was wearing the Mickey Mouse ears. And the third reason, and this is where I might cry and I have no reason to cry, is that John Kuhn is the person that gave me probably the best opportunity about speaking of anyone I've ever met. Because when I was a fellow with him, the year he probably started on benzodiazepines, I think he's off now. I don't know if he ever took that. That was bad. I'm not being recorded, I hope. Anyhow. See, that's, I couldn't tell that joke otherwise. But anyhow, the thing that he taught me is that he let me develop my presentation as a pharmacy student, a PharmD student, and then as a fellow. He let me do it. In my head, the song from Fleetwood Mac is going through my head, and it's like, go your own way. I did things I could watch his eye twitch when I did my preview of my presentation. But he let me do it. And I'm saying that, and I just looked at a couple people who maybe I helped review their residency presentations that I maybe wasn't as open about. So I would say one of your gifts would be to your students, let them experiment with things that you don't think is the best, but may be very effective. When is clip art too much? I don't know. But I think that people have really firm feelings about it. I don't use it a whole lot, except if I'm bored with a slide. Like if I have too many bullets, I'll put in something with color. But I think you have to look at when it's too much, and editing is a really good thing when you're thinking about clip art. Like going through at the bottom, I thought about editing out, but I really like this big pink dragon, so we're going with it. Going old school. This is my favorite thing. If I could teach any way, you would throw out the slides and I would do a whiteboard and I would just draw. So Catherine actually taught me about that thing on the internet, that high-tech thing on the internet thing. That was a joke. Where they like do the draw. That's my dream. Because I think taking people from an idea by getting them through drawing is really helpful. So I grew up using overheads and, drawing on whiteboards. It's still the best way to interact in some situations. When I do patient caregiver, I rarely will use a slide. I go by how patients and caregivers want to go. So the one thing I ask for in a room, if I'm doing it, whether it be a big room or a small room, I ask for a flip chart, because that way you can get the ideas from the audience. It's probably a good idea to do with anyone. So old school can sometimes be very beneficial. Webinars. Webinars is a big thing now. When I worked in corporate America, this is how we got teaching and messages out to a large group throughout the country, because that's where the people that needed to hear the message was. So learning how to use webinars is really, really a good way to learn how to teach. And one of the things I can tell you is the pros and the cons. Here's the cons of webinars. The person on the other line, on the other side, they are very likely not to be doing just the webinar. So those people listening to HOPA, I doubt that they're sitting at a desk in their office with the slides up listening. I bet they're working on something else and it's running in the background. So when you're doing primarily by webinar, your strategies of getting your messages really have to change. It has to be much more succinct, and it has to be something that engages, and often it has to be something that's short. Interaction within webinars is really helpful, and those are some of the ideas. The other thing that webinars are a challenge is that as much as this is a room with bright lights, I can see responses, and I really react to responses. So I react to people not listening to me. I react to people sleeping. I react to people laughing. So my best presentations is when people laugh. I mean, it just is. So if you laugh now, that would really help. But not that fake laugh, because that doesn't help me at all. But I need that. So when I do webinars, my biggest problem, I don't know that, and I go really fast. So if you're doing a webinar, practice it out, doing them short first, get some of those skills sets, and then go to bigger or longer webinars, which is usually what people want. Okay, so here's a little interaction before we move on. After attending a presentation that provided a handout of audio visuals, how often do you refer to the handout after the presentation? So tell your neighbor. So you get a handout. How often do you actually go back to it once you get home? I will tell you, Jane Permer tears hers up before she leaves the hotel room. So when you're talking, think about that when you're thinking about your handout. What do people really want? They want the references. They want the ability to go back. So what do we spend our time on? We spend our time on all those bullets, where we really should be looking at a handout as different than our audiovisual. So I would actually challenge HOPA to look at maybe developing not only audiovisuals of handouts, but maybe supplements of those slide decks to things that people really want. Okay, here's a question. When attending a professional meeting, which of the following is most important to determine if you will attend a session? When you're picking, this is for you to think about. Is it the topic of the presentation? Is it the speaker? Is it the logistics, when it is, how long it is? Or is it the continuing education credit? Okay, now here's the second. When you attend a professional meeting, which of the following is most important to determine if you will listen in a session? So you have two objectives when you're putting a program together, and as a speaker, it's getting people there, and it's having people maintain interest as you're there. And so one of the things to consider when we talk about purpose is how to keep people engaged. So developing content and presentation. Some of this I think I didn't spend as much time on because I think most of us do this routinely. Develop our big purpose, and from that develop our goals. Think of the audience needs, think of the audience goals, and what you have to offer. And so the question of what you have to offer, I would suspect that every person in this room who is speaking has more to offer than the data that they're putting on their slides and they're talking about. And that one of the reasons as oncology pharmacists we're asked to speak is because we come at the management, the treatment, the issues of oncology practice in a different way. So utilize what you have to give that presentation what is needed. If they wanted a physician to present the data, they would have asked a physician. If they wanted to hear the data just by what was the results, that can be provided in a handout. The gift that you're doing is giving the slant of what is needed. So if you're talking about how to treat metastatic prostate cancer, they don't want to know just the studies. They don't want to know the NCCN guidelines. They want to know how you get that patient through in most situations. So those are the things to consider. Narrow your scope. One of the things I have a hard time doing is making sure that what I want to say I can do in the time limited, because as I mentioned, the first 5 minutes are really important. The last 2 minutes are the thing people are going to go out thinking about. Determine the content for the audience. We've talked a lot about that already. How to build on that content. So you have a group. One of the key things is going from a simple idea to make it the idea that you want them to go home with. And so to build slowly. Now, the thing I don't like about this slide is the fact that all of the images are the same size. Depending on your audience, it may be your background is very small and your ideas of application are the most important. If it's a very naive group that doesn't know very much about your topic, then your foundation is going to be really big. And the reason I'm talking about this is because people don't do this. People take an approach to getting someone from a simple idea to a complex as one way, but it should be determined by what your audience's strengths are. I believe that we should get rid of all lectures, including this one, and do it in a TED Talk. I have the attention span, not of a goldfish, but of a gnat. So I like short, brief. So one of the things to think about is if you're doing an hour talk, like I am, or a little bit more, but I'm not telling you that because then you're going to start looking at your watches, that when you look at it, think about how you can break it down into smaller TED Talks. Because the thing that's so great about TED Talks, it's an idea that's focused on for a short period of time. But there is ideas that have more usability than just data. Developing some of the nitty-gritties, developing objectives for presentations. You often will get preset objectives. Utilize those preset ones because they were developed by the organizers for a reason. I used to do a lot of conference management in one of my old jobs, and one of the things that's really challenging to a conference coordinator is to put this great conference together and have some rogue speaker come in and talk about the planting of marigolds when they were supposed to be talking about the biology of immune checkpoint inhibitors. So I think those key things, but the other thing, because I can feel the energy kind of waning. Maybe that's me. Maybe I'm internalizing this. Maybe I'm getting tired. Anyhow, one of the things that I think that when you're writing objectives, think about your audience and think about your purpose. So the way I learned to do this from a guy by the name of Terry Schwinghammer, who I worked with at Pittsburgh, he always did his objectives and he started them with, after the presentation, the participant will be able to. And so this is how people write objectives. After attending this lecture, the participant will be able to provide comprehensive, effective care of the individual receiving immunotherapy, and describe all side effects seen in an individual receiving chemotherapy and provide patient and caregiver education regarding those side effects. No way you're going to meet those, but that's what we say. So really think about what your objectives are that the participant will leave with. Knowing that when you leave this, you will remember 2 things I said, if that, and they may be things that annoyed you. So that's kind of a key point. Strategies for active learning, case studies you guys know, audience response questions. I'm not a big fan of audience response questions because I don't like that dead time. There's very few people that can use that dead time effectively. I have heard as many jokes about dancing and singing as I possibly can when they play music. So really, one of the problems with audience response questions, they eat up the time if you're really talking about a bulky topic. That stop and think, I think, is really good when you just stop and share with each other. Think, pair, share, which is the same thing, small groups, and questions and answers. Okay, a couple things about style presentation. This is from Elizabeth Barrett Browning. I think it makes me sound intelligent that I'm like quoting her. And it says, "What is genius but the power of embracing a new individuality? Do what is best for you." Humor is mankind's greatest blessing. I think humor really has a key place in presentation if you are a funny person. If you are not a funny person, then don't do it. I have a story that I can't tell. It's really making me laugh inside because I have seen people plan jokes that go flat. If you plan a joke and it goes flat, just keep going. Just keep going. I say that because I do it all the time. I often will stop and say, I think this is funny to make people laugh, because then you kind of shame them into laughing. But that's not right. But I do it anyhow. But so one of the things is thinking how you use humor. Figure out who you can learn from. So this is what we're going to talk a little bit about when we talk about writing. The key thing I think that we can do to get our skills better for presenting is find someone who wants us to be better and get their ideas. I tend to find it from many people because I listen to what many people will say. And this is the point that I think this is how I pick up new skills. I go to presentations and I think, I don't like that. I'm not really going to do that. Now, I don't really do that for you guys, but say I was at another conference, I would do that. I would go out. But looking and see what people do. So I was sitting behind Bob Ignafo yesterday, and there was a typo in somebody's slide, and I could feel his whole body start to shake. I really thought he was going to seize or something. And so I'm really thinking, please don't come to my presentation because I'm sure there's typos in mine. So there are certain things people will be really, that really hate. I'm not a big bullet person. Those are things that you learn that you can build upon based on what you like. And so looking at not only people that can help you get better, but look at things that you don't like so that you don't do them. Developing test questions. One of the key things with this is that you're testing, usually in a presentation, for comprehension, not for the details that you talked about. So most of the questions that we get are based on the studies that was just presented. And when people present data, you have to take that. When you read a study, you read it, you think about it, you consider it. When somebody presents and you see one slide, the next slide is a question, my whole stomach tenses up because I can't remember every detail, and I'm an old oncology pharmacist and I should know this. So to create questions that people can feel that they've comprehended, that's probably the best type of questions that you can write. You can do true-false, which people don't like. I love true-false questions because then you're not gaming if you can you're not gaming if you can figure out a multiple choice question. Come on, how many of us did that? These are wrong. There's only one or two that can be right. I can figure it out. That's not saying you understand. A true-false question is it. You know it or you don't. So a couple things for writing questions for bigger groups. So this is a question that I wrote. ML is a 63-year-old woman who presents to the clinic with complaints of pain in her left shoulder. She has a history of early-stage breast cancer. She's status post-surgery, radiation, chemotherapy, and endocrine therapy. She likes the color blue, and she has decorated her house in a French country style. She's active in the care of her grandchildren and does Pilates 3 times a week. Which of the following is true? So key things that they ask you to do when you're writing test questions for boards or other types of standardized tests is take out the junk that you don't need. It's really hard because we like to make these cases sound real. I don't care that she does Pilates. In fact, I really don't want to know that she does Pilates. But maybe you do want to know she does Pilates because of her flexibility being better. So leave in the things that are important and take out the stuff that is not. And then you have your answers. So A, ML may have decreased bone density secondary to treatment. B, ML may have an injury related to her shoulder, unrelated to her history of breast cancer. Both A and B are true. All of the above are false. So For board type questions, you should have 4 answers. 1 is right, 3 are wrong. They should not be multiple. They should not have all above, none of the above. Most of us that write questions do this because it's really hard to find 3 good distractors that are wrong. The other thing that's really hard with multiple choice is what you write today isn't true tomorrow. So one of the challenges is when you're doing multiple choice, that's a limitation. So when you're writing for board, think about things that are true at this point, but know that that may not be there. So this is true, false. Nivolumab is an immune checkpoint inhibitor that may be used in the management of melanoma. True, false, easy. If you know the information, if you don't know the information, it's not easy. And so my goal of a presentation is not that people are smart afterwards, but that they know the key concepts I want them to know. My goal when I teach in a school of pharmacy is that they don't know everything that they need to know about something, but that they know the fundamentals so that they can learn it and they can apply it. So really look at what your questions should be saying, not some nuance that you think you should be testing on. Okay, the last thing we will do in the last 10 minutes is talk about writing. So when I was initially asked to talk to you guys today, it was to talk about speaking. There was another presenter that was going to talk about writing. And so they said, well, you know, the other presenter couldn't come, so would I mind talking about writing? And I was busy that day, and I said yes. And so all I could think about is anybody who's ever worked with me with writing would probably think, why are you talking about writing? Because one of the things that I'm most challenged with probably is writing. And that's one of the reasons I think I can talk to you about some key things to improve your writing skills, because they are all things that I have done. So this time I'm going not from someone that people would actually think that I do a great job, but someone would say, she's gotten so much better as the years go on. And I'm not looking at Bear Goldspiel because he's thinking, no, you haven't, but we'll keep going. So I wanted to start off by saying I hope someday I write something that somebody wants to plagiarize. It's my dream. I really want to write something that somebody quotes sometime. So if I ever write something that you think is profound, put it on a slide and put it on a presentation, because I really would like to see that. That's my goal in life. Okay. Determine the purpose of your writing. And this is a thing that I think is the best advice for you if you want to start writing more. Figure out what you want to write. Because when you look at the opportunities for us to write as oncology pharmacists, we can write scientifically, we can write about our research, you can target publications, and we can write educationally. Writing scientifically is different than writing educationally. Writing scientifically is presenting information and giving some idea of how that information is evaluated. Writing educationally is taking what we know and providing it to people so that they will also know better how to use the information based on our experience. It is the best way to start writing because it gives you an opportunity to really feel comfortable and enjoy what you're writing about. And then the tight, concise writing of science comes easier. So those of you who want to get into writing, my recommendation is 1, pick something you're passionate about because you live with it and it's painful if you don't like it. Target your audience and make sure that your message is one that they want to hear, very similar to when we talk about presentation. Plan the publication that you want to write. Look what the requirements are. Talk to people who have published in that publication. Talk to the editors and seek co-authors. The best way to write is to take your strengths and marry them with somebody else's and come up with a better product. So writing opportunities exist because there is so much information that as oncology pharmacists we can help other professionals and patients and caregivers learn from, but it really is dependent upon what you're writing. Some thoughts about visuals in writing. One of the things I'm seeing more and more is summary tables within the writing that is very helpful. So this was taken from the Immune Adverse Event paper by the Society of Immunotherapy. And it just shows, it takes the information and puts it back. I could have done the same thing if I took the ASCO paper. And it has, ASCO has, it's like second page is, I think it's called the bottom line. And it just gives you a highlight. Writing something and then taking that information and making it very succinct, whether it's internal tables or internal bullets, is very helpful to people because one of the things that we find, well, let's go, is that when we look at writing, People don't read articles, they scan. People read text. In 1970 they did. So people read text because they want understanding. People read articles and they pull things because they want information. So writing so that people can scan effectively makes what you write very effective. So I skipped a couple things I wanted to mention. I wish I was an artist. My dream would be to develop audio visuals that are as beautiful on screen as they are in my head. And I think they're not only for when you speak, but definitely when you write, to give people that visual. And I think we talked about that. Referencing. One of the key things when you're talking about writing is making sure that you're referencing significantly and appropriately. One of the best benefits that you get from a presentation are the references at the bottom. One of the most used things of a publication is the references in the publication. So that information is really important. Some resources for writing, just to mention, reference programs such as EndNotes, I'll show you that in a second. Style manuals are available. And the other key thing is the colleagues that are really good writers. I love sending anything I write to someone who is a good editor. My favorite way to co-author something is that somebody writes a version, I edit it, they edit me, I edit them. The final product is so much better than what they wrote and what I wrote. That was funny. That was a good pause at the end of it. So looking at that is really helpful. And then the other thing is, who's your attendant audience? If you're writing something for a nursing journal, have somebody, a colleague who is a nurse, read it to see if it hits what they're looking for. This is just showing you the EndNotes. The key thing I like about EndNotes, a lot of people like it because it keeps all their references together. I don't like it for that reason. I like it because it can change the style of your references to whatever you're writing. And if you take the time to write something, then you're likely going to benefit from writing it in a different format for a different audience that may have a different requirement for your referencing. So it's a really nice thing to actually use. And the last thing to end before I can ask if there's any questions or comments, how to handle questions and learn from the audience. My least favorite thing about presenting used to be the fact that people would actually get up and then ask me questions. Learning how to answer questions and how to handle questions is probably one of the best things that you can do for presentations. Somebody asks you an idiot question, because there are stupid questions. That phrase, there's no stupid, there are stupid questions. It doesn't mean that the intent was wrong. So trying to figure out what the question really is asking, that's really important. And so if you don't know, that's the benefit of talking to a group of people that are very knowledgeable. Don't make your question and answer be about you and the person asking the question. Engage your entire audience to see if there is information. In HOPA, there is always someone who knows more than you about something that can give that information. So with that, I will do what I just told you I want to do. Any kind of comments, I would really appreciate. So don't think that when I say it's over that you're up and out. Anybody who has things that they want to add that they think maybe they don't agree with me on, if they want to, feel free. But anything to share to help, I would really value that. I would really value someone getting up, walking to that microphone, and saying something of substance. You didn't just sit down because I said of substance.
Mo, I think you're adorable.
I think you're really insightful. Thank you. That was very nice. Come on.
Thank you so much for this wonderful presentation. I'm here because I'm super intimidated by presenting, especially in an audience full of talented and very intellectual individuals. You mentioned something about including all the information you want them to be able to take home in the handout. That's something I sort of struggle with. Are you saying make sure all the key takeaways are there? Because you've provided so much additional information in your presentation that's not necessarily on the slides. So how do you balance that when you're creating your handout?
So one of the things that, because a lot of places will say, here's your slides, we're publishing them, and that's what your handout is. I think a really great thing to do is do supplemental things, which I did not do, because one of the things that you'll find is I'm doing a lot of opinion here. So,
Right.
I could put a picture of me, but I didn't get my hair dyed before I came here. But I think that's one of the, I think the thing that I like the best is when people do a reference sheet at the end that has full references that I don't have to try to get them out of the slides that I printed out. Those kind of things.
Absolutely.
And in terms of being intimidated, I would bet there's not a person in this room that's not intimidated when they get up in front of people. I was pacing outside like a crazy woman. So intimidation, I think that means that you care, and that will come out very much when you present.
Okay, thank you.
Well,
Thanks, Mo, for this session. I had a question. We all present on pretty serious topics, and I'm wondering, you mentioned the keynote speaker was able to be kind of funny and bring in some interesting like sports references and things. How do you do that when you're relatively new to practice and you're presenting on these kind of heavy data, serious topics, and you may not be a super funny person?
okay, I think that question is probably one of, I'm going to do what you're not supposed to do. You're never supposed to say it's a good question or bad question. But I think that's a question that is really important. Because if you are not comfortable with being light, then you shouldn't be light. If you're not comfortable, Tim Tyler, with being serious, then you shouldn't be serious. It's like you really should play to the strengths of what you are comfortable with. I think certain topics don't really warrant humor. My humor tends to be less about the topic and probably more self-deprecating than anything. But you know, that's my personality. So being true to yourself, going with the strengths you have, I think that's when you're a great presenter.
Fantastic presentation. It's very interesting to kind of see how just, as a newer practitioner, other people struggle with the same things despite, 10, 20 years of experience. I had a question in regards to medical writing. You mentioned the utilization of co-authors. I think coming out of residency, it was a little bit difficult having too many co-authors where, despite finishing a wonderful manuscript and then having it go nowhere because there's just so many hands into it. Is there any happy medium or any recommendations that you can make to our future practitioners about that?
Yeah, one of the things I think that is the co-author, there's two, it's the scientific co-authors for projects, right? Is that, I'm getting, yeah?
Yes.
Okay, and then there's the co-authors for educational and maybe reviews and things. One of the challenges I think when you pick a team to work with is establishing up front what their roles are gonna be. And one of the roles is what they're going to do with that manuscript. Like, yes, we want you to review it, but, to a point, because as a primary author, it is your, usually your responsibility to drive that going forward. And so I think selecting up front that is really important. I don't have a great answer for globally when you have a author that is giving you too much feedback, except that the role defined as a primary author is usually to help make those decisions. And any author can always say, I would rather not be on this. And I think that's perfectly fine for someone to say, I don't agree with what you're doing, and so therefore I'm going to take my name off. I don't think that's a bad thing to do. I think that's not a bad thing for us to do, and I definitely don't think that's a bad thing for others to do. So, and then I was talking more with educational, because I do think more than a couple people kind of is crazy. I think working 2 people, 3 people really is optimal. But that's, again, maybe personality.
Thank you.
Anything else people want to share that they feel that I didn't cover or that they think I'm wrong?
Sorry. Thanks, Mo. That was great. I was just going to say, about the slides turned in, that's an ACPE thing, so you have to turn them in early.
So I think that one of the things, so I'm not saying bad to HOPA, I'm saying bad to every organization that lifts, because it is for CE. One of the things that, and tell me if I'm wrong, and definitely tell me if I'm wrong, that you can turn in core slides, and I think that's really appropriate.
Anybody can turn in core slides. It's
No,
just that
core,
if you do
core,
that,
core.
They can't get changed at all.
Yeah. So
I'm just a reminder.
Point taken, very important point. I'm really glad you brought that up. So that's just something I can fester about.
And from the HOPA perspective, the reason we need to see the slides is copyright issues, because you as the speaker right now are owning the copyright. Therefore, HOPA can't distribute some things, which is why your slides look different this year. So that's another reason HOPA needs your slides early.
So one of the things I really appreciate about both of your comments is that is exactly what we needed to hear, the different viewpoints.
Thanks a lot for doing this talk, because I think it's been enlightening for all of us here to get your expertise, because you've been doing this for so long, and we appreciate you being here. One of the things that you had said or mentioned was that you were pacing before this talk even, and I think that for some of us who have to do a talk at any point in time, the nervousness going on that stage is almost overwhelming. And I was just wondering if you could share how you push through that to get on that stage to make it so that you can get a proper and wonderful presentation.
Well, first of all, thank you very much. And you can talk more if you want about that. I am really a nervous before. I pace, but I actually do that breathing stuff. Like, you're taking a breath, hold it. I think they taught me in a yoga class, which I never could do a downward facing anything, but so I do breathing a lot. And the other thing I do, and I know I've probably told many people this, I think about what my purpose is. Like, if I'm nervous about making a fool of myself, which you would think I would be past at this point because I've done it. But I really just want to get a message out. And so that purpose makes me very focused and able to do it. And so those two things, not thinking about me, but thinking about the goal, and also doing that deep breathing, is really helpful. The other thing is I really should not talk to anybody within 5 minutes of a presentation, because I'm snappy then. And so I really try to stay away from people. So if I've snapped at you today or walked away, then you'll know it was my nerves.
Thanks, Mo. I think for me, I really struggle with the writing side. You know that about me. And when you write something and you really put everything into it, you send it in for edits, and then you get comments back, potentially some really negative comments. Any tips on how to move forward with that?
Yeah, because I think, okay, so I'll tell you the story. I did this chapter for an ASHP book in oncology a long time on. It was on palliative care, because it was when I was doing a lot of pain management. And I sent it in. I didn't think it was good, because I didn't think I'm a very good writer. And one of my really good friends was the editor, and she didn't know it was my chapter. So we were sitting around, and she was talking about this stink chapter she got and how it made no sense. It was like, she's still a really good friend, but it was like disheartening. And so what I have learned is and sincerely, what she did to that chapter was wonderful. Like, she took her ideas, she gave them back. It was 100% better chapter because of that. So I really have found that I have to put my ego aside, and I think we all know I have a bit of one sometimes, and so and learn from others, because people that write well, people that speak well, people that can tell you how to be better, worth it. Now, I'm telling this to Danielle, who she just turned in a chapter for a book that I'm helping to edit for ONS, and it was a beautiful chapter that was probably one of the best written chapters I've seen. So if you think from her saying that she writes poorly, it was a phenomenal chapter, and it was the editing was light, but it was fun because because of the respect. So if you think of me and you, back and forth respect, think of anybody, back and forth respect. Like an editor sending it back that says to me, like, you did not explain the immune system well. That is because I didn't explain the immune system well. It wasn't something critical, it was something helpful. I hope that helped.
You probably mentioned this while I was texting, I'm not sure.
Sorry.
I will say probably one of the largest pet peeves of any audience anywhere is when someone stands at a podium and reads their slides. And so I just wanted to reiterate, I know you did say this, the power of story. When you think about purpose, and then you get your information there, and then you take it to that next step of being able to bring it to a story, whether that's personal or a patient case or whatever it is, to make it real, that helps you in your presenting to get off of the slides, to get to the audience, and really consolidate your purpose for that group.
Thank you. I'm going to agree that it's the reading of slides really is just sometimes disengaging. The one place I think reading of slides is really beneficial is in short, succinct presentation of data that you want to get the information out that you may not get out if you're just going by what you're saying. So like when you go to ASCO and they're doing that like 10 minutes, then sometimes reading, but then if you're gonna do that, you have to have every word that it makes the sense that it's gonna hit the mark that you need. So, but thank you very much. I see the other groups here. So thank you guys. I really appreciate you coming this morning. It's been fun.